There's something a lot of men don't talk about, and it's costing lives. Prostate cancer. It's one of the most common cancers in men, especially over the age of 50. But the scary part, it often grows silently. No pain, no clear warning, just quiet changes in your body that are easy to brush off until it's too late. So today, I want to walk you through 7 early signs of prostate cancer that you should never ignore. These symptoms might seem small on their own, but together they could be your body's way of telling you something isn't right. Let's start with the first one. You're in the bathroom and you suddenly notice it's harder to start urinating. You feel the urge, but nothing happens right away. You're standing there, waiting, maybe even pushing a little to get things going. Sound familiar? This is often one of the earliest signs men notice, difficulty starting urination. It happens because the prostate gland, which surrounds the urethra, can press on it as it grows. That pressure makes it harder for urine to pass through. Now, this could be due to an enlarged prostate, not necessarily cancer, but it's still worth paying attention to, especially if it doesn't go away. Another sign, erectile dysfunction. Yeah, we're going there, because it matters. Most guys chalk up performance issues to stress, age, or fatigue, and sure, those can play a part. But when the prostate is involved, especially if it's inflamed or compromised by cancer, it can affect the nerves and blood flow responsible for erections. If you're noticing that things aren't working the way they used to, and you're also dealing with urinary symptoms, it's time to get checked. This isn't about embarrassment. It's about staying alive. Next up, you're going to the bathroom more often than usual, especially at night. If you're getting up once or twice, that's not unusual. But if it's happening 3, 4, even 5 times a night, that's a red flag. Frequent urination, particularly after bedtime, can be a sign that your bladder isn't emptying completely. And if the prostate is pressing on the urethra, that's exactly what can happen. You feel like you have to go all the time, even if there's barely anything there. That brings us right into another symptom. That nagging feeling like your bladder's never really empty. You finish, but a few minutes later, you feel the urge again. Or you head to the bathroom, but only a little trickles out. That incomplete emptying is another subtle but serious sign. Not only is it uncomfortable, it can lead to infections or even kidney problems if ignored. And again, the culprit might be a growing prostate, possibly cancerous, restricting the normal flow of urine. Now let's talk about something most men don't expect: painful ejaculation. It's not common, and when it happens, it often gets brushed off. But ejaculation pain, whether it's sharp, burning, or just uncomfortable, can be a sign of something going wrong in the prostate. Remember, the prostate plays a big role in semen production. If it's irritated, inflamed, or under attack by cancer cells, it can definitely make itself known during sexual activity. This kind of pain isn't normal, no matter your age. Don't ignore it. Speaking of pain, let's talk about pain during urination. Burning, stinging, discomfort. You might assume it's a UTI or dehydration. But if it's recurring or showing up with any of the other symptoms we've talked about, prostate cancer could be in the picture. Painful urination happens when the prostate swells and irritates the urinary tract. It doesn't have to be excruciating. Even mild discomfort is worth getting checked out. Finally, maybe you've noticed that your urine stream isn't what it used to be. Weaker, slower, stops and starts. This might seem like a minor annoyance, but again, it's about pressure. A growing prostate, especially one affected by cancer, can narrow the urethra and reduce urine flow, and this won't get better on its own. The changes might come on gradually. That's what makes them dangerous. You adjust, you ignore it, and time slips by. So let's take a breath and recap: trouble starting urination, erectile dysfunction, frequent nighttime trips to the bathroom, feeling like your bladder isn't empty, painful ejaculation, pain while urinating, weak or interrupted urine stream. These are your early warnings. They're not always caused by cancer, but they're never something to ignore. The earlier you catch prostate cancer, the more options you have, the better your chances of full recovery. So if any of these sound familiar, or if you've noticed changes that just don't feel right, talk to your doctor. Get a checkup. Don't wait. Because catching it early isn't just smart, it could save your life. Thanks for watching. If this video helped you, please give it a like and consider sharing it with someone who might need to hear it too. And if you want more straightforward, honest health content, hit that subscribe button. We're in this together. Take care and take your health seriously.